Good afternoon. My name is Mark Crowther and I'm the president of the Anticoagulation Forum. We've asked you to watch this brief video to introduce the upcoming training program which is being put together by Healthcare Innovations and the Anticoagulation Forum to help educate BMS hospital representatives on venous thromboembolism. As you are aware, the proposed training program is a regionally based 1.5-day training program which consists of presentations, discussions, case study reviews, and panels involving hospital representatives and VTE specialists as well as other healthcare professionals who are involved in the diagnosis and management of patients with suspected or confirmed deep vein thrombosis or pulmonary embolism. The audience for the training program is experienced BMS hospital representatives and managers who come regionally from all of the United States, and we anticipate between 40 and 60 participants at each centers. Each of the representatives is an experienced hospital-based representative who has had extensive training on venous thromboembolism, including the science, causes, signs, symptoms, diagnosis, and management. The product, Eliquis or apixaban, is approved in the United States for the treatment of deep vein thrombosis and pulmonary embolism, and BMS representatives have traditionally called on cardiologists. And although cardiologists in some places are involved in the management of patients with DVT and PE, in many locations the primary diagnosis and management of this condition is provided by other specialists and other healthcare providers. And the purpose of this training program is to introduce the hospital representatives to how you as an individual practitioner may approach these patients. The reason for doing the program is BMS representatives have less understanding of other VTE specialists, their practices, their roles and responsibilities, and how they would evaluate and manage a patient with suspected or proven VTE. As a result of which, BMS asked the Anticoagulation Forum to design and conduct a training program which is specifically designed to help the hospital representatives from BMS understand your practice with respect to venous thromboembolism. The goals of the 1.5-day program are to produce a discussion-oriented and highly interactive set of slides and content that are not designed to be delivered didactically, but are designed to be delivered in the context of an interactive, highly question and answer based educational program. The slides we will provide for you, if you are presenting a presentation that includes slides, have been vetted internally by a number of different parts of BMS and ourselves, and as a result, you really aren't able to change the slide content, but we encourage you to add as much detail and as much additional discussion as you wish verbally during each of the presentations. Particularly, we would like to ask you to incorporate your own real-world experience into the management of patients with suspected or proven VTE to provide your insights into a specialist and how you personally diagnose, treat, and provide consultation for patients with suspected or proven VTE. We want you to help the BMS hospital representatives to understand your specialty in general and you in particular, how you manage this condition. Our hope is that you'll be able to illustrate for the BMS representatives and their managers where and how you interact or encounter patients with suspected or proven VTE and how you help to manage these people. We want you to highlight common challenges and concerns you might encounter in managing such patients, and we would hope that you can help the audience to understand how you approach venous thromboembolism treatment decisions and the factors that influence your decision to use or not use oral anticoagulants in a particular patient at a particular time. We're obviously very interested in your personal opinion and approach with respect to the use of oral anticoagulants, in particular the newer direct oral anticoagulants, but also warfarin, low molecular weight heparin, and other potential treatments. And we would ask that you engage your audience by posing questions directly to them around clinical care and seeing how they respond and how their responses vary from your clinical practice. We would like to ask that you provide lots of times for questions, and the slide decks we're providing to you should allow you to do this, but please keep an eye on the time to ensure that you don't run out of time and you provide lots of opportunity for questions. So I'd like to personally thank you for taking time out of your busy schedule to work on this program. This is a new educational initiative for the Anticoagulation Forum, and we're hoping that through this we can improve the quality of care of patients with or at risk of venous thromboembolism, and in particular to help us to define how patients with this very important clinical condition are managed across the spectrum of hospitals throughout the United States. Thank you for your time and thank you for your participation.